I'm Alex Villarreal with the VOA Special English Health Report. Every few years, two groups do a study of how many Americans wash their hands after using the toilet. These groups are the American Society for Microbiology and the American Cleaning Institute, formerly the Soap and Detergent Association. There was good news in the latest study. Researchers found that 85% of adults washed their hands in public restrooms in August. That was the most since the studies began in 1996. Researchers visited restrooms at a baseball park in Atlanta, Georgia, and a science museum and aquarium in Chicago, Illinois. They also visited two train stations in New York City and a large farmers market in San Francisco, California. In all, they observed about 6,000 adults. The researchers found that 77% of men and 93% of women washed their hands. That was up from 66% of men and 88% of women in the last study 3 years ago. The lowest rate of hand washing among men was at Turner Field, home of the Atlanta Braves baseball team. Only 65% of men washed their hands, compared to all but 2% of women. Chicago and San Francisco had the most hand washers, 89% of adults. Atlanta followed at 82%. New York had the lowest rate at 79% of the adults observed at Grand Central Terminal and Penn Station. The findings of the observational study conflicted with the findings of a separate telephone survey of about 1,000 people. 96% of them said they always wash their hands after using public restrooms. Almost 9 out of 10 also said they always wash after using the bathroom at home. Hand washing can help prevent the spread of many different infections. To clean your hands well, wet them first and rub in soap for at least 20 seconds, including between the fingers and under the fingernails. Then rinse under running water. In a public restroom, if you dry your hands with a paper towel, you should also use the towel to shut off the water and open the door. Hand washing is also important when preparing food and after changing a baby's diaper. You should also wash if you cough or sneeze into your hands. If you use an alcohol-based product instead of soap and water, make sure it contains at least 60% alcohol. For VOA Special English, I'm Alex Villarreal. This is the VOA Special English Health Report. Researchers are finding new ways to save snakebite victims. Experts discussed the latest findings during a recent meeting of the American Society of Tropical Medicine and Hygiene. Scientists in Australia have shown that a chemical called nitric oxide could increase the chances of surviving a poisonous snakebite. The scientists injected rats with deadly amounts of snake venom. Then they rubbed an ointment containing nitric oxide on the skin around the injection site. The study found that the rats lived about 1/3 longer than if the ointment had not been used. But the treatment had to be started very quickly. Dirk van Helden led the research at the University of Newcastle in New South Wales. He says the nitric oxide ointment also showed promise in humans. Volunteers were injected with a harmless liquid that contained molecules about the same size as snake venom molecules. Many snake venoms contain large molecules that can only enter the bloodstream through the body's lymphatic system. The nitric oxide slows the pumping action of the lymphatic system, and that slows the flow of venom into the blood. The study appeared in the journal Nature Medicine. Scientists say the findings could help save many lives. A study from 2008 found that poisonous snakes cause as many as 94,000 deaths worldwide each year. But Ulrich Kook of the Biodiversity and Climate Research Center in Frankfurt, Germany, says new numbers from very rigorously designed and well-conducted studies in India and Bangladesh have come up with numbers that suggest that the real death toll of snake bites at the global level is much higher. Mr. Kook says many deaths could be prevented, but snakebite victims often go to traditional healers or do not seek any help at all. Either because there is no treatment available, no antivenom, which is the specific drug to treat snake bites, or because healthcare staff do not know how to treat snake bites, or because transportation to get to a health facility is not available or too expensive. There is no single antivenom that can be used to treat all snake bites. The antivenom must be specific to the kind of snake that bit the person. In some countries, the treatment is expensive. In others, the problem is a lack of availability or a lack of training in treating snake bites. New tests are being developed to help rural health workers know the right antivenom to give. For VOA Special English, I'm Alex Villarreal. This is the VOA Special English Health Report. 2 recent studies have found that punishment is not the best way to influence behavior. One showed that adults are much more cooperative if they work in a system based on rewards. Researchers at Harvard University in the United States and the Stockholm School of Economics in Sweden did the study. They had about 200 college students play a version of the game known as the prisoner's dilemma. The game is based on the tension between the interests of an individual and a group. The students played in groups of 4. Each player could win points for the group, so they would all gain equally. But each player could also reward or punish each of the other 3 players at a cost to the punisher. Harvard researcher David Rand says the most successful behavior proved to be cooperation. The groups that rewarded it the most earned about twice as much in the game as the groups that rewarded it the least. And the more a group punished itself, the lower its earnings. The group with the most punishment earned 25% less than the group with the least punishment. The study appeared in September in the journal Science. The other study involved children. It was presented in September in California at a conference on violence and abuse. Researchers used intelligence tests given to two groups. More than 800 children were ages 2 to 4 the first time they were tested. More than 700 children were ages 5 to 9. The two groups were retested 4 years later, and the study compared the results with the first test. Both groups contained children whose parents used physical punishment and children whose parents did not. The study says the IQs, or intelligence quotients, of the younger children who were not spanked were 5 points higher than those who were. In the older group, the difference was almost 3 points. Murray Strauss from the University of New Hampshire worked with Mally Pascal from the Pacific Institute for Research and Evaluation. Professor Strauss has written extensively about physical punishment of children. He says the more they are spanked, the slower their mental development. He also looked at average IQs in other nations and found them lower where spanking was more common. What do you think are the best ways to correct misbehavior? Share your comments at voaspecialenglish.com. And that's the VOA Special English Health Report.
This is the VOA Special English Health Report. South African researchers at the International AIDS Conference in Vienna, Austria, have announced major progress in the fight against the disease. The researchers say their study shows a vaginal gel substance reduced the risk of HIV infection among women who used it. The gel contains tenofovir. This is a common antiretroviral drug used to treat people with HIV, the virus that causes AIDS. The study was done by South African scientists with the Center for the AIDS Program of Research in South Africa. It involved almost 900 sexually active women between the ages of 18 and 40. All were from KwaZulu-Natal, South Africa. Half were given the gel containing tenofovir. The other half were given a gel without an active substance. They were told to use the gels 12 hours before sexual intercourse and again within 12 hours after sex. Both groups were told the gels were experimental. They were advised to use another form of HIV prevention. The study lasted 30 months. Women who used the tenofovir gel reduced their risk of HIV infection by 39%. And the study found that the women who used the gel more often had even better results. Women who used the gel more than 80% of the times when they had sex had 54% fewer HIV infections. The scientists say the tenofovir gel was also effective against another sexually spread disease. The gel reduced the rate of infection of herpes simplex 2 by 51%. Health experts say the results of the study show that tenofovir gel can empower women. They say it will enable them to protect themselves from HIV infection when involved with sexual partners who refuse to wear condoms. However, researchers say they will study why the gel did not protect in all cases. Some scientists say the amount of tenofovir in the gel may be too low. Others say some women may have had sex with infected men who had very high amounts of the virus. Still others say some women may have had vaginal conditions that made them more likely to become infected. The researchers also said they will carry out more studies to confirm the results. And that's the VOA Special English Health Report. Transcripts, MP3s, and archives of our reports are at voaspecialenglish.com. You can also find us on Facebook, Twitter, and iTunes at VOA Learning English.
This is the VOA Special English Health Report. A study has raised questions about a widely held belief involving cholesterol. The belief is that high levels of so-called good cholesterol in the blood can reduce the risk of a heart attack. The medical name for good cholesterol is high-density lipoprotein, or HDL. Doctors commonly believe it reduces the risk of heart attack by removing fatty deposits that can block the flow of blood in the arteries of the heart. But Dr. Sakar Kathariasan at Massachusetts General Hospital in Boston says the effects of high HDL have never been proven. He says the new study that he and other researchers did suggests that HDL cholesterol does not affect the risk of heart attack. He thinks the study has now broken the major assumption over the last 30 years that if you raise HDL cholesterol, the risk for heart disease will be lowered. The researchers say about 4% of people have a genetic variant, a change, that gives them a naturally high level of HDL. The study found that those who were genetically programmed to have higher HDL levels were just as likely to suffer heart attacks as those who were not. A second analysis looked at 14 gene variants that increase good cholesterol. Dr. Kathariasan says people with the most variants had no more protection against heart attacks than anyone else. But he says there is no dispute about low-density lipoprotein, or LDL. LDL, the so-called bad cholesterol, causes a buildup of fatty substances inside arteries and increases the risk of heart attack. The findings appear in the Lancet Medical Journal. Another widely held medical belief has also come into question recently. For years, men over the age of 40 have been told to get a simple blood test to see if they have prostate cancer. Now, experts on a government committee are advising them not to. Dr. Virginia Moyer heads the United States Preventive Services Task Force. She says, close to 2/3 of older men have prostate cancer, and yet the huge majority of them never have a problem from it in their lifetime. The task force examined 2 large studies before deciding that treating the cancer found by the PSA test can do more harm than good. Effects of the treatment can include a loss of sexual ability and bladder control, as well as other problems, including heart attacks. Some doctors support the findings of the task force, but others disagree. Urologist Deepak Kapoor says in about 20 years of PSA testing, death rates for prostate cancer have dropped by 38%. For VOA Special English, I'm Carolyn Presutti.